welcome to another vlog. I'm Dr. Joydev, and today's topic is the health benefit of almonds. I would look into the literature and I will try to analyze this thing in a scientific way. I'll be I'll be reviewing some literature, the scientific literature publications related to this topic, and I'll try to find out whether the myths about the almonds, whether the informations that we usually find in internet about almonds, whether these are true or false. So let's move into today's discussion. So first, what is almond? Almond is a referred to as a category of food which is a nut in category. That means it is an edible seed. So we can eat this seed. We do not eat all the types of seeds, but it is one of the edible seeds. Now, what are the composition of almond? 30 grams of almond it usually contains 180 kilocalorie of energy. Next, 6.3 grams of protein. So there is a sufficient amount of protein in it. 16.7 grams of fat. 11.5 gram of monounsaturated fat, which is helpful for cardioprotective, which is known for its cardioprotective role. Monounsaturated fats and polyunsaturated fats are cardioprotective. It also contains 3.1 grams of polyunsaturated fats also. It also contains 2.1 grams carbohydrate, 2.2 grams fiber. Fiber is helpful for gut health, for our GI system. It contains 72 milligram of calcium. Calcium is important for muscular function and neurological functions. 81 milligram of magnesium. Magnesium is also important for a lot of functions. It contains 7.19 milligram of vitamin E. Vitamin E is helpful for neurological function. It helps in it has a antioxidant property. It also helpful to maintain skin and hair health. It also contains 14 microgram of folate. Folate is important for blood formation and neurological development. So let's look into the benefits of taking regular almonds. So what are the scientific literatures? Let's have a look. So there is one publication in British Journal of Nutrition. So a renowned journal in nutrition. There is a publication called Appetitive Dietary and Health Effects of Almond Consumed with Meals or as Snacks as a randomized controlled trial. So in this study, it is observed that 55 grams of almonds a day reduces the risk of weight gain. So this study demonstrates that if we take 55 grams of almonds a day, and it will reduce the risk of weight gain. But how does it reduce the chance of weight gain? If we consume it as a snacks, it contains a lot of nutrients, so it will reduce the hunger. So it will reduce the appetite and it will cut down the excess calorie that we take. So it is so this study indicates that there is an important role of almond in weight reduction. Also, it is said that it helps to reduce the risk of heart disease. So it is quite important. A lot of us we usually take almonds uh, being concerned about our cardiac uh, wellness. So we have to look into the literature whether it is cardioprotective or not. Let's have a look into the literature. So a randomized controlled trial of the effect of an almond enriched hypocaloric diet in treatment of obesity. So this study was done on populations. who are obese. And the population has been divided into two parts. One groups have been given a almond rich diet, and another group uh, they were not given any almond rich diet. And what are the results? It is seen that there is greater reduction in the total cholesterol and triglycerides. So these two are some factors in development of heart diseases, because total cholesterol, triglycerides, they usually causes heart disease. So in this study, we have seen that the almond reduces the level of cholesterol as well as triglycerides. So in this way, almond reduces the risk of heart disease. There is another study, the effect of almond on anthropometric measurement and lipid profile in overweight and obese females in a weight reduction program. So this study was uh, planned incorporating some weight reduction program. In this study, overweight and obese females were included, and one groups were given almond enriched food, and another group were devoid of that almond enriched food. Now, let's see what are the results. It is seen that there is greater reduction in low density lipoprotein, systolic blood pressure, and there is greater increase of LDL-C. So, how it is important? Low density lipoprotein and systemic blood pressure, these are two of the risk factors for development of cardiovascular diseases. Now, in this study, it is seen that the level of low density lipoprotein and systolic blood pressure, they are reduced. On the other hand, the level of HDL, that is getting increased in this population. HDL is a type of good lipid or good fat which helps to reduce the chance of cardiovascular diseases. So, thereby lowering the level of low density lipoprotein along with the systolic blood pressure, and on the other hand, increasing the level of HDL, ultimately they reduce the chances of cardiovascular diseases. Now, there is another study. Almonds and almond oils have similar effects on plasma lipids and LDL oxidation. So, it is also seen that almonds oils are also important in reducing the levels of LDL and thereby reducing the risk of heart disease. This study also states that the effect of almond supplementation on glycemia and cardiovascular risk factors in Asian Indians in North Indian with type 2 diabetes. So this study was done on the Indian population, North Indian population, those who are having type 2 diabetes. And in these studies, we have seen that there is reduction. There is reduction in the waist circumference, waist to height ratio. That means there is lower incidence of obesity. Serum triglycerides are decreased, low density lipoproteins are decreased. They indirectly reduces the chance of cardiovascular disease. Also, there is decrease in the glycosylated hemoglobin. That means the sugar is under control. HSCRP or highly sensitive CRP, that is also reduced, and that indicates there is reduced chance of cardiovascular diseases. So this study demonstrates that there is lesser incidence of obesity, cardiovascular disease, as well as there is a good control of diabetes in patients in persons taking almond enriched diet regularly. Almond consumption improves glycemic control and lipid profile in patients with type 2 diabetes. This study also demonstrates that there is good glycemic control in in people's taking almonds. There is another study that says that there is role of magnesium in glycemic control, and as we know that almonds contain plenty of magnesium also, so indirectly it can control the diabetes also. But there are limited studies. Actually, there are limited human trials in benefit of almonds in brain development. Okay, although almonds are enriched in vitamin E, folate, unsaturated fatty acids, all these compounds are helpful for brain development, but there are limited studies, limited human trials that can demonstrate the roles. But uh, definitely, if there are any human trials, then we'll be having more information regarding that. It also supports gut health. That means it helps to maintain a proper uh, gut flora. Gut flora means the type of bacteria, the type of common cells that lives in within our gut, and they are helpful to us in a lot of way. And this almond, they actually helps in maintaining a healthy gut flora. Now the most important question that is, who are not who should not be taking almonds? The persons with allergy to almonds should not be taking almonds. If someone experience any kind of allergy, rash, itching after taking almond, he or she should not be taking almonds in future, because almond can precipitate a serious type of reaction that is known as anaphylaxis. Anaphylaxis is a type of reaction where there is itching, rashes, swelling of the face and other parts of the body associated with respiratory distress, and this is an medical emergency. This has to be managed promptly. So those who are having any allergy to uh, almonds should ideally not take almonds in future. And also we have to keep in mind that whenever we are giving almonds to any elderly person or child who is not able to chew it properly, then we should better give them in a paste form or in a powder form, so that there is reduced incidence of choking. So, if you are new to this channel, then don't forget to subscribe to this channel, because in this channel I usually post different health related topics. I usually analyze different health related topics. I used to answer your health related queries in a simplified way. So if you find this video helpful, don't forget to give us a like. If you are new to this channel, don't forget to subscribe, and also don't forget to hit the all notification bell, because whenever I'll be posting any health related video, you will get a notification of that instantly. Till then, take care and stay fit, be healthy. Thank you.